Impression compound, impression materials. We will be discussing impression compound today. So we all know different types of processes that is being employed in prosthodontics or in the dental field. These includes the removable partial denture, complete dentures, fixed partial dentures, veneers, dental implant, and its processes. These are dental implant prostheses that you see in the picture. And for any processes to happen, we need a cast. So cast is defined as a life-size likeness of some desired form, or it is formed from a material poured into a matrix or impression or from a cam printed replica. So that is cast. You can see different edentulous patients cast in the above picture. This is an edentulous mouth and its respective cast. For an dentulous person, the cast will be like this. This is only a section of the cast. So these are just pictures showing the dentulous and edentulous impression and the cast. This is an impression making procedure for a veneer. So for a cast to happen, we need a proper impression. So what is an impression? An impression is a negative likeness or copy in reverse of the surface of an object, or an imprint of the teeth and adjacent structures for use in dentistry. And an impression material, it is defined as any substance or combination of substances used for making an impression or negative reproduction. And at the pictures, you can see various impression materials like green stick, light body consistency elastomeric materials, alginate, impression compound. And for this impression to happen, we need some help from some other things like impression trays. So an impression tray is a receptacle into which suitable impression material is placed to make a negative likeness. Or it can be defined as a device that is used to carry, confine, and control impression material while making an impression. So the purpose of an impression tray can be simply considered as to carry the impression material to oral cavity, to hold the impression material in close proximity to the teeth, to avoid breaking of the impression material during removal, to prevent warpage of the completed impression. Just like that, the trays can be classified into three. According to the material, they can be metallic or plastic. According to structure, they can be perforated or non-perforated. And according to the area of coverage, they can be quadrant, sectional, or full trays. So these are the quadrant, sectional, or the full trays. And here you can see the stainless steel or metallic, perforated, and non-perforated trays. The perforated tray is the one that you see at the bottom. So what is a selection criteria for the impression tray? It should be comfortable to the patient. It should extend slightly beyond the facial surfaces of the teeth, extend approximately 2 to 3 mm beyond the third molar, retromolar pad, or tuberosity area of the arch, sufficiently deep to allow 2 to 3 millimeter of material between tray and tissue surface. Now the requirements of impression materials. So there are various impression materials, and for impression material as whole, these are the basic requirements. It should be fluid enough to adapt to the oral tissues, should be viscous enough to be contained in the tray, while in the mouth it should set into a rubbery or rigid solid form. The set impression should not tear or distort when removed from the mouth. It should have pleasant taste, odor, and aesthetic color. It should not contain toxic or irritating ingredients. It should have adequate shelf life for storage and distribution. It should be economical. It should be easy to use with minimum equipment. It should have adequate setting characteristics that meet the clinical requirements. It should have satisfactory consistency and texture. It should have adequate strength. It should possess elastic properties. It should be dimensionally stable. it should be compatible with the die and cast material, basically the gypsum materials. Now, the classification of impression materials. It can be broadly divided into either elastic or non-elastic. The non-elastic material includes impression plaster, impression compound, waxes, zinc oxide, eugenol. And the elastic one includes the aqueous hydrocolloids, basically the alginate and agar. The agar is the one that is a reversible hydrocolloid and alginate is the irreversible hydrocolloid. Then the elastic can again be divided into the non-aqueous elastomers. The elastomers includes the polysulfide, polyether, and the silicones. The silicones are condensation silicone and adhesion silicone. Then according to the mode of the setting, they can be divided into the impression material that sets by chemical reaction and those sets by temperature change. Those set by chemical reaction include impression plaster, zinc oxide, eugenol, alginate, and elastomers. And those set by temperature change includes impression compound, impression wax, agar hydrocolloid. Again, the classification slide according to the setting mechanism and the elastic and inelastic nature, both combined into a single table. So these are various kinds of impression material. Now, the ADA specification numbers. Impression compound, ADA specification number is 3. Zinc oxide eugenol impression paste, ADA specification is number 16. Dental agar impression material, ADA specification is number 11. Non-aqueous elastomeric impression material, number 19. Dental duplicating material, that is number 20. Dental gypsum products, number 25. Coming on to the impression compound. The impression compound, ADA specification number 3. From the compound C, you can take A, B, C as a third letter, like that. You can remember this. It's also called as modeling plastic or modeling compound. It was introduced in 1871 and it is a rigid thermoplastic impression material which sets by temperature change. It is the most viscous of all the impression materials. It is mucocompressive in nature. The materials can be mucostatic, mucocompressive, basically, and of this one is a mucocompressive. It is usually used to make primary impressions of edentulous ridge, and from the primary impression or the preliminary impressions, we usually make the primary cast, and the primary cast is used to fabricate the custom tray or special tray, which can be used for making the final impression for a complete denture scenario. So the types of impression compound includes type 1 and type 2. Type 1, it is called as, it can be divided into low fusing and medium fusing. And the type 2, which is called as tray compound, is called as a high fusing, is considered as a high fusing. So the low fusing one, it is the green stick compound, and the medium fusing one is the impression compound. So the low fusing, it is usually used for doing border molding for custom tray in a edentulous situation. And the medium fusing impression compound, it is used for making the primary impression in a edentulous patient. And the high fusing material, that is a type 2 or the tray compound, it is used for tray preparation for the secondary impression. The applications: making primary impressions in an edentulous mouth, individual tooth impressions, peripheral tracing or border molding to check undercuts in inlay preparations, to make electroform dies, to make special tray, to stabilize matrix band in operative procedures. This special tray, it is basically for the type 2 or the tray material. It just acts like a supporting material for the tray. That's all. So these are the primary impression, and the second picture is of the low fusing one, which is the border molded one, that is a green stick compound. So it's available as cakes, sheets, sticks, or the cones. Then requirements of an ideal impression compound is that it should harden at or little above the mouth temperature. It should be plastic at room temperature, not injurious or harmful to the oral tissues. It should harden uniformly when cooled without distortion. It should not undergo any permanent deformation or fracture while withdrawing. from the mouth. It should be dimensionally stable after removal and during storage. It should exhibit a smooth, glossy surface after flaming. It should withstand trimming with sharp knife without flaking. It should not boil and lose volatile components. The basic composition: it is a mixture of waxes, thermoplastic resins, organic acids, and fillers. Resins, it's about 40%, waxes 7%, organic acids or plasticizers about 3%, fillers about 50%, and it will have some small amount of coloring agents. The resin and waxes, it includes the main ingredients. Resin are amorphous organic substances which are insoluble in water, and it includes the shellac, damar, and rosin. And waxes, it basically includes the beeswax, which is a form of impression wax. Plasticizers improves the workability and also overcome the brittleness, and it reduces the tackiness of the compound. The added plasticizers include gutta-perca and stearic acid. Fillers, these are inert materials which are chemically distinct from principal ingredient, and it is added to overcome the tackiness, to get a control on the degree of the flow, increase the rigidity, and minimize shrinkage. Commonly used fillers include talc, chalk, calcium carbonate, limestone. Coloring agent basically included one is iron oxide. The color basis regarding the melting temperature. So the green color, it's usually the melting temperature is about 50 to 51.1 degrees Celsius. The black or gray one includes 53.3 to 54.4 degrees Celsius, and for the red one, 54.4 to 55.6 degrees Celsius. Properties of the impression compound. First one, thermal properties. A glass transition temperature and fusion temperature. When a compound is heated at approximately 39 degrees Celsius, the material loses its hardness. However, at this stage, it is not plastic or soft enough for making an impression. This temperature at which material loses its hardness or brittleness on heating or forms a rigid mass upon cooling is referred to as the glass transition temperature. While fusion temperature, which is around 43.5 degrees Celsius, it is that temperature at which the material will soften to a plastic mass and can be manipulated. So in the glass transition temperature, it's not completely plastic, while in fusion temperature, it is completely plastic. The temperature at which the plasticizer melt or solidify. Below the fusion temperature, it will start to get solidifying. Once the impression tray is seated, it should be held firmly in position until first fusion temperature and later glass transition temperature is reached. That is, we have to hold the impression tray in the same position without any movement until it cools down below the glass transition temperature. Significance: the impression made above is made above the impression fusion temperature, and it is removed when it cools down below to its glass transition temperature. So impression is made above the fusion temperature, and it is removed when the temperature is below the glass transition temperature. So above fusion temperature, crystalline fatty acids melt and lubricate the softened material into a smooth plastic mass, and on fusion temperature, the fatty acids solidify and the non-crystalline fatty acids solidify at glass transition temperature. Thermal conductivity. A very low thermal conductivity and diffusivity is the property of the impression compound. So it has a very low thermal conductivity. So what is the significance? The significance is that during softening, the outside will soften first and the inside softens last. So the material should be kept in water bath for sufficiently long time so that it gets uniformly softened, and then only we should knead it well. And during the impression making procedure, the layer adjacent to the oral tissue will remain soft even though the outer layer appears to set fast. So we have to wait a little bit more time compared to that of the when we compare the outer surface of the material. The inner surface that is in contact with the oral tissue will be soft. So we have to wait a little bit more time for it to cool down before removal. Coefficient of thermal expansion, it is actually high because of the presence of high amount of resins and waxes. Average linear contraction of impression compound is about 0.3 to 0.4 percentage. So, and volume expansion is about minus 1.38 to 2.29 percentage. That is, there is a contraction that is being happening, and so the distortion chances are more, and hence the impression has to be poured little early. Contraction error can be reduced by obtaining an impression as usual and then passing the impression over a flame until the surface is softened and making a second impression. The shrinkage is relatively slight, and since only the surface layer has been softened. So this is one method. Then second method is by spraying cold water over the metal tray just before it is inserted in the mouth. The material adjacent to the tray will be hardened while the surface is still soft. So like that also we can reduce the contraction errors. Rheological properties, that is flow. Flow of the material should be minimum at mouth temperature, but sufficient flow is needed at a temperature not more than 8 degrees Celsius above the mouth temperature. So above 8 degrees Celsius, there should be sufficient flow. More than 6% flow in set material causes dragging and distortion. So maximum flow that we require is about 6%. So for the type 1 and type 2, so type 1 is the low fusing and the medium fusing, that is the green stick and the impression compound. So at 37 degrees Celsius, the flow should be less than 6%, and at 45 degrees Celsius, it should be more than 85%. And for the tray compound type 2, at 37 degrees Celsius, the flow should be less than 2%, and at 45 degrees, it should be around 70 to 85 degrees Celsius. 85%, sorry. Viscosity. Impression compound is the most viscous impression material that is being employed in dentistry, and the viscosity of the impression compound is highly dependent on the temperature. Significance. Surface detail reproduction, since the viscosity being too high, is little less, and pressure has to be applied during the impression making procedure, which makes the impression to compress the mucosa, and the obtained impression will be mucocompressive one. Dimensional stability. It has got poor dimensional stability due to the unavoidable release of the residual stresses, and to reduce the warpage and distortion, impression should be poured immediately. So coming to the manipulation, the compound disc is completely immersed in water bath at 55 to 60 degrees Celsius for about 4 to 5 minutes to ensure complete softening. Then a gauze is placed at the bottom of the water bath to prevent the adherence of the material onto the water bath. So this is how the impression material is being placed into the water bath in the help of a gauze. Then the compound is usually, we can add it as a full cake, or usually we add it in small pieces for uniform heating. Prolonged immersion in hot water has to be avoided to prevent leaching out of plasticizers. Then the compound has to be kneaded well with our fingers, and it's kneading when soft and wet increases the flow. Improved detail, and it gets a improved detail recording. Kneading is done with fingers only, and 20 seconds will improve the flow to 6.4%. 60 second or 1 minute of kneading, 13% flow, and 180 seconds, 24.5% flow. The compound is then loaded onto the tray. As you can see, for the maxillary, or the maxillary arch, will make it into a bowl shape, then spread it with the fingers onto the stalk tray. With the mandibular arch, we will knead it into a rod shape and then place it in the respective tray. So bowl shape for the maxillary arch and dumbbell shape for the mandibular arch. The insertion temperature is usually 42 to 45 degrees Celsius, that is 5 to 8 degrees Celsius than the body temperature. And firm pressure is used to seat the tray in the mouth, and cast should be poured immediately without delay, that is within 1 hour. And we can use the disinfectant solutions like 2% glutaraldehyde solution, iodophores or chlorine compounds, or phenolic sprays to disinfect the impression, and we can pour the cast. The cast is separated from the impression by immersing it in warm water, so that the material will become softened and we can remove it easily. That's how the impression is being made. So for a maxillary impression, you have to stand behind the patient and then place the tray properly. So you can see it's in bowl shape. It's spreaded well onto the tray. The tray has to be seated or put into the mouth by retracting the cheek with fingers and also with the tray. And for the mandibular, you will stand on the side of the patient or slightly in front of the patient. It will be in dumbbell or rod shape. You will spread it. Then keep it in the patient's mouth, press it firmly, mold or the cheeks, and also the we will do the tongue movements And once we get the impression, we'll disinfect and wash it, disinfect it, then we will pour with dental stone or dental plaster. And once you complete that, you will proceed for your that's the primary cast, and on the primary cast you will make the special tray. And at this part you will be using the low fusing compound, that is a green stick compound, and on the border of the tray you will apply the green stick compound in sections, and you will do sectional border molding, and you will complete your peripheral tracing, and it will be ready for making the final impression. So what are the, that's with the impression compound. We'll go through the advantages. Advantage, it can be reused a number of times in case of errors for the same patient. Inaccurate portion can be remade. Accuracy can be increased by flaming the surface of the material. The material has sufficient rigidity to support itself. It is non-toxic and non-irritant. It can be electroplated. Disadvantages, poor detailed reproduction due to high viscosity, mucocompressive in nature, distortion due to poor dimensional stability, difficult to remove from undercuts, possibility for overextension in peripheral portions. Since it's being a rigid material and difficult to remove from the undercuts, we are not employing it in the dangerous situation. Then it does not have a pleasant taste, uncomfortable to the patient because of the rigidity and temperature. Thank you.